and I'll reference them in my opening comments. I want to welcome everyone to the press conference this morning. We're here in Fleetwood, Pennsylvania at Weaver's Hardware. Weaver's Hardware store is one of the businesses in Berks County that we are proud to say is doing their part to stop the spread. We'll be hearing from the owner of Weaver's Hardware shortly. I just want to take you through our agenda this morning. The commissioners will all speak. I will be making some additional comments. I will introduce each of the commissioners. After that, you will hear from the owner of Weaver's Hardware, Ed Shenk. After that, you're going to hear from our two healthcare partners here in the county of Berks, and those healthcare partners are Penn State St. Joe's and Tower Health Reading Hospital. We'll be hearing from Dr. Gregory Sorensen from Reading Hospital and Dr. Jeff Held from Penn State St. Joe's. We also will be hearing from our Berks County District Attorney, John Adams. And following John Adams, we'll be hearing from some key folks in the city of Reading. We'll be hearing from Jeremy Searfoss, he's the fire marshal, and the Reading Emergency Management Agency coordinator. I do want to recognize Bill Stout, the Chief of Fire and Rescue Services, is also here. And then our final speaker will be Rich Tornelli. He is the Chief of Police for the city of Reading. When he concludes, we will open it up to a time of question and answer. I want to start by noting I'm holding in my hand a death certificate. This is the 52nd person, Berks County resident, to die in the last several weeks from COVID-19. I'm here today as your county commissioner to let you know the numbers are bleak in Berks County. They are serious. This individual was somebody's father, possibly someone's husband, and he's the 52nd person to pass away in a relatively short period of time. If you have a question on the numbers, because there is a little bit of discrepancy between what you see on the state, we're simply presenting the death certificates from the coroner's office of individuals in Berks County that have been certified that they died as a result of COVID-19. But I want to draw your attention to some other statistics. This is part of some modeling that was recently provided to us, courtesy of Tower Health Reading Hospital and Penn State St. Joe's. This is bed demand and surge model, first looking at total confirmed cases by counties. You look at the dates, this is what I want you to focus on. The gray line is Berks County. You can see out in here we're doing pretty well, but around the 7th, where we saw our cases jump triple digits day after day, that number has jacked up significantly. That is a serious problem for Berks County. Secondly, we want to look at something called the doubling rates. And this might appear confusing. You would think if you're high on the chart, that's not good. But it's the opposite. Doubling rates is how many days does it take for the county to double the number of cases. The more days it takes, the better job we are doing limiting the spread of COVID-19. Up here, if you look at Chester, I believe that's Chester, or Lehigh, they're up to 10 days to double. This is Berks County. we are under 4 days to double. If you look, this has been our track record. We are not doing well. And what this means, and we're hearing this from people across the county, businesses and individuals are not doing enough. The basic things, like wearing a mask. I only have the mask off right now to do this presentation. These numbers are dire. But if we don't get serious, and serious quickly, as businesses and individuals, this is what we're facing. This is bed demand surge model. It is based on regular operating capacity of both of our hospitals. And what it is showing in the next couple of weeks, if we don't change things, we're looking at a shortage of ICU beds of between 111 and 175. Of just ICU beds. General available med-surg beds, a shortage of between 405 and 652. I don't want to be melodramatic, but these numbers are bad. Now, I will tell you the hospitals are doing everything they can, and we're going to hear from doctors from both of these hospitals to push these numbers back by finding additional space. But what is driving these numbers is not what the hospitals are doing. What's driving these numbers are what we as Berks Countyans are not doing. Not enough of us are wearing masks. As of yesterday, the governor has ordered anyone coming into a business, any staff in a business must wear a mask. We need to step up. We need to make that happen. We need businesses that are going to step up. Last thing I want to highlight, excuse me, we started a campaign on Monday in Berks County, the 3 commissioners and a number of partners. We're doing our part to stop the spread. This is a poster we want individuals to put up in their home, on the front door, in the front window, letting people know that they're supporting Berks County businesses that are following health and safety regulations. We need to be standing together with the businesses that are doing it right. But secondly, we need to celebrate the businesses that are doing it right. This is a sign that we're going to be giving today to Weaver's Hardware. We have signs for your other 2 stores as well. We're open. We're following recommended protocols for your safety. If you have any recommendations, please contact, and that can be a name, a department, contact information. And a guidelines, and I'll tell you, I don't know that you need the guidelines here. You can see them when you come in the front door. They're letting people know what they need to be doing and why they're doing what they are doing. We're here today, 1, to let you know the situation is serious. 2, to let you know that the modeling looks very bad for the next couple of weeks. But 3, you as a Berks County resident and as a Berks County business can make a real difference. And that's why I'm proud. I'm very proud to introduce our next presenter. Our presenter is Ed Shenk. I've actually known Ed from years ago, shortly after you bought this. I've heard in the last week and a half from a number of different people, Weaver's Hardware, primarily the Sinking Spring store, and Commissioner Barnhart was the person yesterday. He said they are doing it right. I'm going to ask Ed Shenk to come. He is the owner of Weaver's Hardware. Explain to us what they've done and why.
So if you look behind us, when the COVID pandemic first came, we first became aware of it, we realized really quickly. The first thing they talked about was washing hands. And we were like, we can do that. We can sanitize, we can wash hands. We're on a wooden floor that has a basement under it. We put a sink in here. We had the ability to do that here. At the other stores, we put sanitizing tables in. And then every time throughout the year, throughout the last 4 weeks, as people came up with new ideas, we were like, why wouldn't we adopt them? If you'll notice behind the register, the shields, the plexiglass, probably about 2 weeks ago, we first put a shield up at register, 2 foot wide plastic shield like they were talking about. I looked online, we couldn't really see examples of a sneeze shield. That was a sneeze shield. We're like, we watched customers and we said, that doesn't do much good. So a day later, we switched it out to this. The why behind all of this is simple. The most important asset a company like my wife and I own, Weaver's Hardware, that we have are associates. If we can take care of protecting them to the best of our ability, they will have the energy, the health, the mental capacity to be open and help customers get their needs that they need to take care of their places. And the trade-off on that is, as customers come in, they see what we're doing and they start to practice better habits. Our priority from day one has been the safety of our teams. And that flows right into safety of the community. And so it's been tough. Our associates were only working 8 hours a day right now. For 2 weeks, 8 hours a day, they barely could walk out of here. They were that mentally exhausted from trying to help customers stay 6 feet away, trying to help customers practice even a simple thing like washing your hands, trying to practice that kind of behavior. So we put structure into it. The more structure we could add to it, the more the expectation becomes normal. And it really does feel like we hit a turning point. Our customers know what to expect when they come in. I am really glad in one sense that Wolf made it mandatory for a mask, because now we can say this is a mandatory, you have to, and we're not just the only people out there doing it. When we were cutting edge, people were going, why do we have to wash our hands? Why do we have to wash, and but ultimately it just comes down to safety, guys. I mean, we can't guarantee anybody's safety, but the more things that we can do to make sure that our teams are safe, and then that you're safe when you come in our buildings, the safer our communities will be, and we can hopefully be a part of flattening that curve.
Thank you very much, Ed. I assume the new sign we're going to see, instead of no shoes, no shirt, no service, it's going to be no shoes, no shirt, no mask, no service. But thank you very much for leading the way. I want to recognize Vice Chair of the Berks County Commissioners, Commissioner Kevin Barnhart.
Thank you. Good morning, Commissioner Leinbach, and thank you all for being here. And thank you to Ed and your wife and your associates for really setting the tone, what everyone should be doing as a business owner in Berks County and beyond. As Commissioner Leinbach pointed out, I'm a frequent customer at their store in Sinking Spring. And I went there Saturday, and I was just amazed by the concern you had, not just for your associates, but for the people coming in and out of the store. My wife has an underlying health condition that has not been out of the house for well over a month. So I'm the guy running here to there to pick up our essentials, and I see a lot of non-compliance out there. This is so important for us to send the word that Weaver's Hardware stands head and shoulders over many other businesses out there. I'm not doing this to shame you, but you really, truly have to understand, this is about us getting back to normal. Okay, everyone wants to get back to normal. Everyone's getting frustrated. My father's in a senior living center. I haven't seen him for 5 weeks. I'd like to get back to normal with my family. So do everything in your part. These graphs tell a real dramatic, compelling story. Let's send a word to our family, to our friends. Let's start to understand how serious this virus is and how once we stop the spread and flatten that curve, things will be better. Lastly, we see on the local news and the national news almost on a daily basis, especially in New York, celebrating the healthcare providers, the first responders. what you can do more than anything than clapping for them, cheering for them, is to help them with this graph, to not overtax our healthcare system, to be proactive, do the right thing so their healthcare system can absorb who is coming in, treat those folks who are coming in, and discharge them back to their loving families. So please, this, I beg you, just continue to understand how serious this is, and we really want everyone to get on board, not just in Berks County, but everywhere across our country. So we all want to get back to normal in some way, shape, and form, and by doing this, takes us in that right direction. So thank you.
Thank you, Commissioner Barnhart. At this time, I want to recognize Commissioner Michael Rivera. Commissioner.
Thank you, Commissioner Leinbach, and thank all of you for being here. I want to echo the comments of my two other fellow commissioners, thanking Ed and all he's doing at his stores to be able to help and stop the spread of the coronavirus. Each one of us needs to play our role in this, no matter if you're a resident, no matter if you're a business owner, if you're an employee, no matter what you do work-wise, we all have a part to play in this. What we will be rolling out as well is there'll be a poster coming out with just this bottom part here that says, do your part, stop the spread. And we're going to be asking people to take pictures with it or do short videos of what they are doing to help stop the spread. I did a few to share with my fellow commissioners, but they're not for public use. I'm going to do some others, which we're going to start today. But the hope is that we can go viral and that we can help people understand that everyone has an important part to play in this role here. We've also made these posters in Spanish as well. I just want to take a minute to say a few words in Spanish to reach out to our Spanish-speaking residents and business owners here. Para aquellos de ustedes que no entienden inglés, quiero dejarles saber que todo el mundo tiene que jugar una parte importante aquí en poder parar la propagación de este virus. Todo el mundo tiene que hacer su parte. Es importante que usted use su máscara cuando salga, mantenga el distanciamiento social, lávese bien las manos. Cada uno tenemos que cuidarnos. Tenemos personas que amamos que han sido atacados por este virus y nosotros tenemos que hacer nuestra parte para ayudar a parar esto. Así que, por favor, hay unos posters aquí. Busque esta información. Si usted va a un negocio y usted ve que ellos no están siguiendo las reglas que tienen que seguir, por favor, déjeles saber. Dele esta información para que ellos puedan hacer lo que tienen que hacer para protegerlos a ustedes y a nosotros también. So just said some words there in Spanish, but we're asking everyone to play a part in being able to stop the spread of the virus. Also, we talked about stores where you go in, like the hardware store, grocery stores, but there's something else that's important, and it's the companies, the manufacturers, the warehouses where they have large amount of employees working together in small spaces. I'm calling out to you as well to do your part to protect your employees. Your employees are an essential part of there. I get calls every day. My father is older. He's worried about where he works at. They're not following proper guidelines. They're not wearing masks. They're not wiping down. What can be done? So to you businesses who have large amounts of employees working in small spaces, on assembly lines, fruit processors, please play your role. It's important that each one of us take care and do what we can. You have your employees, please take care of your employees. I know it's important, business needs to go on, but we need to do our part. We need to be safe, and we need to do it in a way that's protecting everyone. Thank you very much.
Thank you very much, Commissioner Rivera. This is not just a message from your elected officials. We want you to understand that the modeling that's behind us, we didn't create that. That couldn't be possible for Berks County if it wasn't for our partners, Tower Health Reading Hospital and Penn State St. Joe's. At this time, I'd like to recognize Dr. Gregory Sorensen from Tower Health Reading Hospital for some comments. Dr. Sorensen.
Well, Well, thank you. I'm Greg Sorensen. I'm the Executive Vice President and Chief Medical Officer for the Tower Health System, in addition to work that I'm doing along with Dr. Ron Nutting, leading now the physicians across Reading Hospital. I want to first of all thank the commissioners and Mr. Shenk for the wonderful work that you're doing, both in terms of modeling the behavior that is absolutely crucial for us to flatten the curve. You've all heard that in the media, but we do need to flatten the curve, and we need to have the curve not only flatten, we need to have it begin to go down if we're not going to overwhelm our healthcare facilities here in Berks County. Because I have a system role, I also get to see our 6 other hospitals that go all the way down into Philadelphia with St. Chris Children's Hospital and with Chestnut Hill Hospital. Philadelphia, as you probably know, is an earlier impact than where we have been here in Berks County. We believe that what happened with the spread of the virus was coming into New York and the East Coast and beginning to spread from east to west. I also have family in Seattle, and we happen to be in Seattle at the end of February to see family, but that's when the outbreak came up in the nursing home, and we chose not to get together with family from a social distancing standpoint because we didn't want to have potential spread of us to them or them to us. I think those are the kinds of things that the modeling here going on is. What we've done is we've used models in conjunction with a couple of organizations. We certainly modeled this after the University of Washington epidemiology work that's being done there. That's being used across the country at this point in time, and we're sharing this broadly with Berks County and working with our partners at St. Joe's to look at all the beds in Berks County that we have. And I can tell you right now that Reading Hospital has sufficient beds to meet the current needs. We have more capacity because we have intentionally not participated in all but emergent and urgent care that has to be provided to our patients so that we have that current and future capacity. We're also doing that to protect our personal protective equipment, masks, and in the hospital, face masks and shields and gowns, all of which is in a national crisis. Every hospital across the country is struggling to get the basics that we all took for granted 6 weeks ago, prior to this event occurring. So we're all in the same boat across the country. The more we can do to level that curve and have it start to go down, the better we will do in terms of preventing this disease impacting our hospitals and the care that we have to give outside of what is going on with COVID-19. We currently have adequate ICU beds, medical surgical beds here in Berks County at Reading. We have adequate ventilators. And we, like St. Joe's, I know, are looking at other kinds of creative things if when the peak hits us, we do not have sufficient beds. So we are opening up areas of the hospital that traditionally have not been used to house patients. Those areas are in a developmental phase right now. We hope not to be able to use them, but we're creating that capacity so that we have that in case you all, as our community, need care at Reading Hospital and at St. Joe's. I don't have a lot more to say other than only you can prevent that peak continuing to go up, because you as a community and with what's being done here by our businesses in Berks County of modeling the correct behavior, caring for their clientele coming into the organizations of all of our businesses here in Berks County. So I commend you and your wife and all of the weavers here in town for that kind of modeling and caring about your customers. We care about you all as patients as well. We want to make sure that we have adequate capacity to be able to care for them. We also want to protect our healthcare workers. We measure on a daily basis the number of patients that we have in our hospital that are being tested, that are COVID positive, and where we have negative tests. We do that as well for any of our physicians, our employees, our advanced practice practitioners, and any of our frontline caregivers where they become symptomatic. We measure that. What I can tell you at this point in time is that we've had several hundred physicians, nurses, and other employees within all of the tower systems that have been exposed, became symptomatic, and we tested and monitored them. All of them to date have acquired their contact in the community, not in the hospital. So we're protecting our employees, our docs, and our nurses, but only you can protect us when we're out in the community. That's important for us, it's important for you. With that, I don't have any more to say except thank you all to the commissioners, thank you to Weavers and Mr. Shenk and his wife, and thank you to you for what you're doing in the community for your social distancing. Keep it up, wash your hands, wear masks, do not be in large meetings. Make sure you do social distancing by more than 6 feet and limit the time that you are out and about. Thank you very much.
Thank you, Dr. Sorensen. At this time, we'll hear from Dr. Jeff Held. He is with Penn State St. Joe's. Dr. Held.
Good day. I appreciate the opportunity, commissioners, to present here. I'll leave my mask on. We, like every hospital, are preparing for this. Our staff, physicians, nurses, and cleaning staff have all pulled together to do their jobs in ways they have never done them before. We're looking at the resources in the hospital to use them in ways that can be more effective and protect ourselves and our patients. The simple request that we all have is what you've heard here many times, and I will reinforce those. Wear masks in public, wash your hands, and not the traditional wash and wet, but 20 seconds. You want to sing the happy birthday twice while you're washing your hands to properly clean them. You want to maintain at least 6 feet of social distance between you and your neighbors and friends when you're outside so that you can protect yourself and your neighbors. 97% of the people who will come in contact with this virus may do fine, but those 3% out there that don't know it until they catch the disease will have serious health issues. That 3%, if all get sick at the same time, can seriously affect our ability to care for patients. So you have the ability not only to protect yourselves, but your neighbors, your family, and your friends. Thank you.
Thank you very much, Dr. Held. At this time, I'd like to recognize Berks County District Attorney John Adams. John?
Thank you. And I want to thank our commissioners. I want to thank the owner of Weaver's Hardware for setting a great example. And this is an example that we need to repeat for all businesses that are operating as we speak in our county. My office and myself have fielded numerous complaints over the past month regarding businesses that were not compliant, and we have sent police officers out to stop at those businesses, and to date we have been very successful in asking for and requesting voluntary compliance. I think we're moving into a new stage as we move forward, unfortunately, which will require some more precautions, wearing masks, being 6 feet apart, and we are going to ask law enforcement throughout our county to again respond to businesses that are not being compliant. We are asking people and who live in our county, if they see a business that is not complying with social distancing, the wearing of masks, utilizing all of the tips that we've received from the medical profession to stop this crisis, to please contact their local police department. Don't call 911, call your local police department, lodge your complaint, and I will be encouraging our police departments throughout our county, and I will be mandating those police departments throughout our county to respond and to demand voluntary compliance by the businesses and the people who live in this county. I also want to add that we've received a lot of complaints about individuals who are out participating in, I'll call it recreation, which is needed. I understand that. But again, do not participate with large groups, wear a mask, and also practice social distancing. I do not want us to have to mandate that those recreation areas need to be closed. We need voluntary compliance. And we are going to demand voluntary compliance so that we get better and not worse. Thank you. And I am asking again that people call with their complaints, their local police departments, and do not call the 911 center on these matters. Thank you.
Thank you, John Adams. I want to recognize the City of Reading. We are very glad to have them here. For those that may not realize it, the City of Reading is our largest municipality. They are geographically central to the County of Berks, and they are a great partner in this battle against COVID-19. I want to recognize Jeremy Searfoss, and I want to get this title right. He is the Fire Marshal and Reading Emergency Management Agency Coordinator.
Thank you, Commissioner. The City of Reading has been working in conjunction and very close collaboration with our partners at the county, as well as Tower Health and Penn State St. Joe's. This is a level of collaboration that hasn't been seen in the past, but there's only so much that we can do. So we are asking you to help us, help you. Simple things, masks and hand discipline as far as cleaning things. Again, maintaining the social distance you see that's demonstrated here before you. We are each other's neighbor, as Mayor Moran says frequently. And that is true not only in the City of Reading that is very densely packed, a lot of people in a small area, so that makes us have to be a little bit more diligent, but the county as well. We are all in this together, and we are employing people today to help us get the message out. Take that extra second to say, well, you can talk from there. I'm going to take a step back because I want to. Sometimes people have difficulty with determining how far back, whatever you're comfortable with. If you have to go arm to arm to give you some distance, that is completely appropriate, and I don't think anyone would be offended by that. Bear in mind, this will be the new normal for the foreseeable future. But we want to make sure that people are aggressive with social distancing, hand washing, wearing masks, because those things are going to save lives, and that is the absolute bottom line. Thank you.
Thank you very much, Jeremy Searfoss. Also want to recognize Chief Tornelli. He is Chief of Police for the City of Reading.
Good morning. I want to first start off by saying I echo a lot of the sentiments you just heard from our Fire Marshal and Emergency Management Coordinator, Jeremy Searfoss. My message is really to the City of Reading and larger to Berks County. Your police and fire departments in the City of Reading are prepared to deal with this emergency, to respond to this emergency. We have contingency plans in place for any eventuality that we may encounter. So we are here, we are fully staffed, we are fully functional, and we are here to serve the residents. As the Fire Marshal said, and as Mayor Moran always says, we are each other's neighbors. While the police department and fire department are prepared to deal with any eventualities, this is really a type of situation where our residents can play the largest role. We need to be great neighbors to each other, not just for the folks that live in your neighborhood or live in the City of Reading, but in Berks County, in the larger regional area. It is a time for us to come together, to follow these guidelines, to follow these rules that have been put in place, and to protect each other. I just want to conclude by thanking the county commissioners, the City of Reading administration for the leadership that they have shown the past couple of weeks as we deal with this pandemic, our partnership and cooperation with our fire department and emergency management team, our command staff within the police department, and also some folks that I think don't get a lot of recognition who are working behind the scenes tirelessly throughout this planning stages of the pandemic, who are making sure that our personnel have the proper personal protective equipment, that the information is coming out to help us manage it, and that is the folks at the Berks County Department of Emergency Services. So I thank them for their leadership, their guidance, and their efforts to protect all of us as we go about our work. Thank you.
Thank you, Chief Tornelli. At this time, we'll open it up for any questions that you may have. Karen.
The Senate passed a bill to try to open up businesses as quickly as possible, the Pennsylvania Senate. It looks like maybe they're trying to open them up May 1st or somewhere around there. Do you think that we should be opening things up? Or what kind of timeline are you looking at, or what you'd like to see?
I think the commissioners have made our position very clear. The focus needs to be on effective standards to protect the health and safety of employees and customers. And we believe that if a business can demonstrate that and will be held accountable to do that, then it's fine for them to open. But we have asked to change the debate from who should be open or who should be closed to everyone, residents and businesses, implementing sound health and safety standards to limit the spread of COVID-19. That needs to be the focus. If a business can't do that, and I'll give you an example, a movie theater can't do that. I don't see how a movie theater is going to be reopened in the short term. That's the focus. The focus needs to be health and safety. If it isn't, this is the result. A real crisis. Other questions?
And maybe you can speak to it, or maybe the district attorney, but do we have enough resources if businesses are open? We're getting complaints. How is it going to be enacted? Are they going to, who has the authority to go in and say, you're not doing it the right way? What's going to happen to you?
Well, there is, with the most recent mandate that has been given by the Department of Health, it has mandated a lot of licensing agencies throughout the state to enforce this, along with the Pennsylvania State Police and local police, who can give out citations if the businesses are non-compliant with the orders. We are going to emphasize voluntary compliance here in Berks County, and we're going to hope that everybody does the right thing. If we do find a business that is just completely non-compliant and will not listen to the advice of the police or a licensing authority, they may be put themselves in a situation where they will be fined and or potentially closed by the governor's office.
Thank you, John. Any other questions? Yes.
So at one point we talked, and like given these like doubling rate numbers that you're showing us today, we talked about the closest, for lack of a better word, overflow facility for a surge would be in Lancaster. And I know one of the doctors mentioned that they're looking at like finding spots in the hospital that would be for those patients if we do get beyond the bed capacity that we have. Is there like another facility that you're looking at now that these rates have changed, or?
There is not another facility that we're looking at. We approached, along with the hospitals, the Pennsylvania Department of Health about an independent facility, and specifically offered some potential locations, and were told, no, the Department of Health is not going to allow Berks County to set up an independent facility. We're at the point right now that there's no time to do that if we wanted to do it. And so the hospitals, and I'm looking for one of the docs, Dr. Sorensen or Dr. Held, either one, to reiterate what they are doing right now. These are numbers that we're looking at if the hospitals don't take any additional extraordinary efforts. They are taking those efforts right now. So why don't both of you just briefly address the kind of efforts that you're making to address surge. So Dr. Sorensen, Dr. Held.
So the efforts that we're taking right now are to look at all of our equipment within the institution, all of our available rooms on the usual medical surgical units and our intensive care units. We also know that it's important for us to have negative pressure rooms, particularly in our ICU for those patients that are in fact COVID positive. So we do not allow the COVID to go further back into the institution. So we have taken out windows, replaced part of that window pane, and put fans in that actually create negative pressure in those rooms. We are looking at areas that we had previously not been utilizing that were previous hospital areas, previous hospital beds, and when we moved into our new tower, we decommissioned those as actual patient rooms. We're looking at those as rooms and gearing those up. We're ordering additional equipment with regard to things like beds, ventilators, other kinds of protective equipment for our staff. Dr. Hill said one of the things that we're doing is also using our usual PPE materials in very different ways than historically we have done. We are re-sterilizing the N95 masks. We're re-sterilizing gowns within our organization that at one point in time would have been single use and discard. We are looking to all the sort of non-traditional areas for equipment like our anesthesia machines to utilize those and bring those back into service as a ventilator if we need to do that. We're hoping that we do not need to do that. We are looking at other areas of the hospital that can house patients and figuring out how we staff those, how we create more physical space for them. We are intensely using telemedicine across all of our organizations and are standing up a virtual intensive care unit starting tomorrow with all 7 of our hospitals, rolling it out tomorrow at Chestnut Hill with backup from our intensive care doctors here in Reading and Pottstown, and we'll create a virtual system across all of our area hospitals. We're doing that to create capacity that we hope we never have to use. So those are the kinds of things that we're working on. We're also looking at staffing plans. How can we have more providers come into the area? And I think the governor has been very helpful in diminishing many of the usual Commonwealth requirements for physicians coming to this area and having to set up for a license. We can now credential them very quickly through the initial licensure process and then through our individual hospitals, both here at Reading but also elsewhere across Tower Health. We're looking to staff in areas that they are historically trained for from a staffing standpoint in terms of their educations, and asking them and training them to staff up to additional areas like in the ICU, where we're making sure that we have the appropriate clinical care around them and they have the clinical background, but stretching our staff a little bit more than what we would have done 2 or 3 months ago. So those are the kinds of things that we're doing, and we're finding that our nurses, our physicians are very highly engaged in doing that kind of work. They're at the front line right now, but they're also anticipating that it's going to get much more difficult in the coming days. So that's what we're doing. We're also moving equipment across our Tower Health facilities. So we have moved additional ventilators to Chestnut Hill from St. Chris Hospital. We have the ability to track all our ventilators in the system, and we'll move them around as we need. And we'll certainly partner with St. Joe in the needs that they have, that we will all have here in the community in Reading. I did forget to do one thing in my initial presentation, and that was to thank you all in the community for your generous donations to all of our area hospitals that are really keeping our frontline staff safe. So thank you. Other questions?
Dr. Hill.
Like every hospital in the country, we are doing similar things. We've taken HEPA filters and expanded our negative pressure rooms so we can have the right isolation. We have purchased as many ventilators as we can possibly get, repurposed many ventilators that are used for other areas. We've not only opened wings that have been decommissioned, we've also looked at space that is used for conference rooms or end of hallways to see if we have to, we can use those. Our staff and our partnership with Penn State Health has been immensely helpful. We've been able to leverage their groups to help support the hospital with additional staffing between nursing staff that's in the outpatient setting that's volunteered to help, to physicians and advanced care practitioners who have volunteered to help come into the hospital and help care for patients, knowing that our regular staff is going to be seeing more patients than traditionally are in the building. We've looked at our personal protective equipment, and yes, we have repurposed, re-sterilized, and reused them as a way to optimize those resources. The staff and the physicians have been immensely helpful in this process. It is not the way we've been trained, but we understand, based on the fact that there is a limited supply and it's an international limitation on supplies, that we really need to make do with the resources we have and make the most of those. It is an incredible team effort. I'm extremely proud of the entire staff. Nurses, physicians, cleaning crews, everyone has stepped up their game to do the right thing to make sure that we're prepared. And we just ask for your assistance in that process, and we thank you all.
Thank you, Dr. Held. Any other questions?
What part of the county are y'all seeing the largest surge? Is there any particular areas in the county?
We do not have access to the data from the Department of Health telling us where the cases are located. That's the reality, so we don't know where the 1,335 cases are located.
And do you think this surge that y'all have seen is because of more testing that is taking place in the county, or do you think these are like new cases that have come up since?
The surge modeling that you see here is based on a lot of different factors, but it is particularly impacted by what we've seen in Berks County over the last 7 days. And if you look, we had modeling just prior to this that didn't show a serious problem. This information, after talking to our partners, we decided needed to be made public because it's clear to us many of our residents and many of our businesses are not taking the COVID-19 issue seriously enough. Let me say this. If you, as a resident, have to go to a store and you walk in the front door and you don't see people wearing masks, turn around and leave. We need to understand this mask doesn't protect me. This mask protects Ed from me, and Ed's mask protects me from Ed. Because wearing masks is about limiting the spread of aerosol and droplets. And so we're telling people, turn around and leave. It is our hope businesses will understand they need to protect their employees. We're going to wrap this up, and I want to thank Ed and Christine for opening up your facility. Giving up this much space under normal conditions in a retail environment is tough enough. You look at what they're doing here, space is at a premium, so they've sold no Yetis, no candles. Hopefully this wasn't a hot area for sales, but thank you for leading the way. That's why we're here, and we are glad to recognize any other business that's stepping up and protecting their employees and protecting their customers like you are. Thank you. God bless. Thank you. We have a packet of posters for each of your stores. So Commissioner Rivera will give those to you, and we will get out of your way. Thank you.